Welcome to another episode of Montana Shares. I'm your host, Bill Crane, and I've got Jane with Montana Child Care Resource and Referral Network. Welcome to the show, Jane.
Thank you, Bill. I'm happy to be here.
Great. So COVID, it affects all of our groups in different ways, but I think you're probably one of them that's kind of in the front lines, doing a lot of great work and a lot of needed work. So tell us how COVID's been affecting the childcare industry here in Montana.
Hugely. COVID has had a huge impact on the industry. Childcare providers are struggling with meeting the health and safety standards. Originally, back in March, most of them closed and then have slowly reopened as parents are returning to work. The providers are reopening. And so they're struggling with that whole health and safety, making sure that they do health checks every morning with both parents and the children. If the parents happen to enter the facility, they're really struggling with when to allow children in. Not so much if the child has a fever and isn't feeling well, that's easy for them. But if a parent tested positive or a grandma tested positive, can that child go to care, and therefore can those parents go to work? So it greatly impacts what impacts the child care facility, greatly impacts the workforce. And so providers are doing the very best they can on health and safety, on intensive cleaning procedures every single day, on kids have rocked wearing masks. Can I say that? Kids are very good about wearing masks. That has not been the issue. But social distancing often isn't an issue with children and keeping them socially distanced. And so there's just so many and lots of issues with child cares. And if a child tests positive or a staff member, which is actually more common, that facility must close for 2 weeks. As an example, we just had our micro classrooms run by United Way that have 2 separate facilities, both needed to close this week for 2 weeks. And so that's a hardship on parents. That's a lot of kids go to those facilities. That's a hardship on parents needing to figure out what to do so they can continue to work. And so there's just been many challenges. And I really respect the way the community has really leaned in across the state, whatever community we're talking about, has really leaned in on the child care issues and started many pop-up programs, and how providers have really met the challenge as best they can.
Mm-hmm. So what do you think is the most interesting adaptive thing that has taken place in the current environment to kind of keep the bases covered? Anything come to mind?
Well, masks appear to be working nationwide. Mm-hmm. and like I say, kids are really good about wearing masks.
They're far more adaptable than we are, aren't they?
They have. I mean, kids just don't seem to notice. I think adaptability is play equipment. It's hard to take kids outside and keep that play equipment sanitized. That's so that's a constant all day long thing. I'm trying to think about what is the best. I think the health checks in the morning. They take temperatures every day. They do this little quiz. Parents are used to coming into a facility and dropping their kids off. Now they meet them in the parking lot. So I think those have been pretty effective.
Okay. And so kind of you help people with some of the, how shall I rephrase it? We've been putting so much stuff in place so fast that a lot of people don't even know what's going on. And you guys are helping try to translate that to the people. Is that correct?
Exactly. We provide significant guidance to child care providers on how they can meet those health and safety, and share what some providers are doing that's successful for them, and it might work for other providers. The guidance from the governor's directives and the governors from the separate health departments, and trying to keep them in with that guidance. We have coaches that will do observation. We're limiting our insight as much as we can to limit one more person being in a facility, but that is still a possibility. We've also had significant funding from the state that we have administered and released, been part of that process. And then we also have the special circumstances scholarships that go directly to families who, for any reason, cannot take their child to care. health reasons, special needs of some kind. And so those have been really big projects for us. We have done, we opened those out the end of September and have had 898 applications in just my region, and there's 7 regions throughout the state. And so that has been a huge process for us. And
You're basically saying over 800 applications in like 7 days or something like that?
no, but we had, I think in first 3 weeks, we had 500 and some.
Okay.
So whatever that's been, the end of September, I must have said that wrong. End of August, thank you.
Okay.
So
I was worried
we've
about
gotten that many in about 5 weeks.
Okay.
But that is huge
Still
to
a lot.
process those. It's huge.
Yeah. Just the sheer numbers of how much you get to, how much attention each application gets. The
Yeah, and I know
mathematics.
the Highline has, we're kind of up there as far as within the state. The Highline has had double the applications we have. So
Okay.
it's been very busy.
So let's change the focus. Let's say outward, things that people can do to make the world of childcare easier. Obviously, wear a mask. What else?
Wear a mask, keep your children home if they're sick. Because I think we as parents just really get under that pressure of needing to go to work and feeling guilty. But if children are sick, to prevent the spread of the disease, we need to keep them home. Support, I think a positive, and not that I want to say anything is positive about a pandemic, but for the industry, it's brought forth the how essential childcare is. And, we have a new session coming up. There's things happening statewide and nationally. If parents and community members could really support what's happening within the legislature to help with childcare funding, that's a huge plus. So I think those are the 2 things I'd say first.
Okay, and then let's go back out to the people that have kids and whatnot. I know you've got all these applications. I'm assuming applications are probably still open. Is that a correct statement or not?
It is open. We're actually just running out of money, but I know that the state, the Bureau, the Early Childhood Services Bureau, is seeking additional funding. So we are still taking applications. We're putting them on a wait list, and have high hopes of receiving additional funding so we can continue to fund.
Okay. Well, what else should we be talking about in this arena and our current environment?
Yeah, sure, make that hard. Just that, just how important and how essential childcare is to our economy and our workforce. I can't express that parents cannot go to work, they cannot go be full-time students, and not just that they need care, but they need quality care. And we have plenty of information, whatever region you're in within the state, but we have lots of information on what quality care looks like, how to choose quality care. There was a death in Great Falls within an unlicensed and illegal facility. So things you can do, those are just huge reminders for us about how important it is to look at the quality of the care you're seeking for your child.
Okay, I think you really nailed it on the head. It is an economic factor as well, because these are the parents, if they're home taking care of sick kids or just wanting to be safe and doing that, then that's that many people that are not in the workforce. We already have enough unemployment already. So
exactly.
Taking whatever steps to keep the whole process working is important.
And it's a hard time for parents, and the quality and the availability of care is key to their success in the workplace.
Okay. Well, thank you for the work that you are doing to facilitate that. Thanks for being on the show, and have a wonderful day.
You too. Take care, Bill.